Thank you so much, dear Elite, for such a wonderful presentation. Good afternoon, dear colleagues, dear doctors from all over the world. I am so happy to see you all, and to start this webinar about this new product. I personally waited a long time this product. Today I will talk how we will do this presentation. I prepared some theoretical slides for us to understand what are the exosomes, what effects they give, and how we understand their potential. And then we will have two models, two patients. I will use an injectable mesotherapy and also microneedling. So now I will start with the presentation. Yes, so we will show you the screen. So we will talk about exosomes, and because this is really the future of skin rejuvenation. For those who didn't know me, I'm Dr. Ekaterina Lica. Yes, I'm a specialist dermatologist. Already with Presensa, we work together, I think, more than 10 years. Also, I'm a founder of Lica Doctor Academy, and also I'm a specialist in regenerative and longevity medicine. So that's why exosomes, it's part of my active practice. So what are the exosomes? Exosomes are known also like ectosomes, so are the extracellular vesicles that are very small. They have diameter from 30 to 500 nanometers, and they are naturally produced by the living cells in order to communication between the cells. So they can be produced by animals, by plants, by microorganisms. So what they contain? So these are vesicles that contain DNA, RNA, lipids, proteins, cytokines, heat shock proteins, enzymes, and also antioxidants. And if we talk about functions, what they do, they can regulate the gene transcription, they regulate survival and proliferation, also reproduction and development of the cells, they promote angiogenesis, they host microbiome and interfere and help with the immunity stimulation. Also, they prevent apoptosis of the cells, and also they have the metabolic reprogramming effects. So what effects have exosomes on the skin? They have anti-inflammatory effect, our immunomodulatory properties, so calms down any inflammation. We talk now about not only about acne, but also about any skin diseases that have inflammatory processes. Also healing and hydration. Also they stimulate synthesis of extracellular matrix like collagen, elastin, and also have the effect of skin protection. So as the result, we can use it and in aesthetic medicine and also in dermatology. So in aesthetic medicine, like anti-aging, like wound healing, antioxidant, or we can stimulate microbiota, regeneration, and also in dermatology for wound healing, for immune dermatosis, pigmentation, scars, and also hair regrowth. So this is like universal product. So how are the types of exosomes? There are natural exosomes that are isolated from biological substances, from animals or from the plants. Modified exosomes that are synthetically produced and synthetic biomimetic and also modified, but the most potential have these natural exosomes. But if we compare, for example, plant exosomes with mammalian or synthetic exosomes, we can see that the plant exosomes have only positive effects and do not have any negative effects. In the same time, the mammalian from animal or human exosomes, they can have also secondary metabolites, they have industrial scalability, and also can have some toxicity depending from the source, and also very low stability, so they are absolutely unstable. But if you talk about plant exosomes, they are very, very stable. Like exosomes have a potential of penetration very high because the size of the exosomes is very small. Because, for example, the skin pore size is 30-50 nanometers or 30,000, 50,000 nanometers, but exosome it's only from 30 to 500 nanometers, so very small. So that's why the exosomes can penetrate through the appendices, through intercellular, and also even transcellular they can go. So they can enter the cell and they can go through the cell. And as a result, they can have these nice results. So if we compare, here you can see the comparison with human and plant exosomes. So plant exosomes have very small molecules, they have low immunogenicity, so, and also they are vegan friendly, and animal can have also cytosolic proteins and also cholesterol, and they are more complicated for extraction. So the source of plant-derived exosomes are the most good source is from Centella asiatica, and the extratome of exosomes from plant structures has very high concentration. We cannot have very high concentration like 100 billion exosomes in 1 milliliter. So this is extraordinary quantity. So here I showed you the how it is process of extraction, how they can be seen like small vesicles. So they come through all the controls to obtain these exosomes, but the unique part of presenza exosomes that they contain not just exosomes but also the so-called phytopeptidic fractions. So they contain also peptides, growth factors, proteins that have the maximum potential for anti-aging, skin barrier restoration, and also hydration. So here, yes, you can see how many exosomes we can have in 1 milliliter. So a huge amount of exosomes with the maximum potential. So how they look also here. And yes, that's why it's called exosomic peptides. Peptides that have even more potential for skin regeneration. So these exosomes are come from Centella asiatica, which is also known as tiger grass, and this effect of these exosomes now works on the new idea of regenerative medicine of reversion of the cell senescence. So we not just stimulate collagen production, elastin production, hyaluronic acid, but we really rejuvenate our cells. So, and this is the most important thing. So we make our cells younger. And through this, we have the results. We stimulate regeneration, proliferation, detoxification. We protect DNA of the cell, and also we improve cell morphology. So we really rejuvenate the cells. The processes that we use we stimulate cell proliferation, cell detox, DNA protection, and cell reshaping. So if we talk now about exosomes or the exosomes peptides from Presensa, this is a really newest technology of cellular transformation and intensive rejuvenation with lyophilized exosomes. So this is like a next generation of mesotherapy. It has a vial from with the two vials. That one contains lyophilized vial with the exosomes and also the activator. So what does Exocell treat? So it treats fine lines, loss of elasticity and sagging, also dehydrated and dull skin, spots and uneven skin tone, also environmental damage, but it can be also used for skin diseases like atopic dermatitis, any psoriasis, if scars management, and also for hair regrowth. So this is universal product. So what contain this vial that contains exosomes with peptides, contains Centella asiatica exosomes, also, but not only. You can see here that it has also glycine that stimulates collagen production, lysine, also amino acids that strengthens also the collagen, proline, and also citric acid. Activator, or hydra activator, contains hyaluronic acid 1%, also glutathione, sodium DNA, DMAE, and methylcinolone or silicium organic that also stimulates collagen. So here we have not only phase or cell rejuvenation, but also the activation of the collagen, elastin, and another regenerative effects on the skin. So here I will show you quickly a few results. So we, after it was done studies where we see the skin elasticity improvement, also the clinical evaluation of the wrinkle intensity. Also, we can see wrinkle reduction with 78%, texture improvement with 51%, pore reduction with 65%, also dark spots reduction with 30%, red spots reduction with 63%, also porphyrin reduction and predisposition to acne with 57%. And really it was done, that study of the quality of the skin and also how women have their impressions of how they look, that they feel and their skin start to look 10-14 years younger after this course. So this I wanted to tell you about short theory. And now, if you have maybe any questions, I can answer now, or we will start till we prepare. We will ask now the patient to come, and I will start to do the procedure, and I will show you how I will start to dissolve the product. Ion, can you ask to bring the patient? Пациент, да. и он птицелац. So. Elia, can you hear me? Yes? Everything okay? Yes. So, yes, so we have our patient. And first we will do the treatment with the mesotherapy technique, with the injectable technique. Okay. Yes, perfect. Okay. Yes, we will make it to be visible good. Now I will start to prepare the product. I will show you how it looks. Okay, so we have a pack with two vials. Yes, so one vial has powder, yes, with exosomes, amino acids, peptides, and also another vial is already with the hydroactivator, with hyaluronic acid, cinnalone, also DMAE, sodium DNA. Yeah. So how we mix it? We open both vials. We take syringe of 5 milliliter. We take the solution hydroactivator, and then we put it in the another vial with the dried exosome peptides. So now I put a hydroactivator in exosome peptides. Okay. So I mix it. And then I will take the product in a syringe of 1 milliliter. And for mesotherapy, I will use the solution of bad quality. How it's Okay, so now I will, so the exosomes are dissolved. Now I take a syringe of with 1 milliliter, yes, and I take it, so I prepare, so I prepare syringes. Почему нет интернета? А там все хорошо подключено, а тут подключено хорошо? Да. It's okay? Now? Now you see well? Now well? Okay. Maybe some because we... Voice okay? Visible, everything okay? Because now I am prepared, we will start the treatment. Yeah, but they need to see in the... They don't see? It's like a stop? Stop. But it's not visible, or what? But this quality, it can be zoom. Quality can be zoom, I don't know. But yeah, we recording, we will have a good quality video. Yeah, so I will start the mesotherapy, yes. So I use, it's possible to use 34 or 32 gauge needle. How do you feel? Okay? And I inject small superficial with the technique of superficial dermal papule. Important that you don't feel, ну, ви знаєте, такий дуарі препарату. What is very important that the patient doesn't feel the pain, so the product is not painful. Patient can feel some of injections with needle, but not the product, because sometimes the solution can be very painful, and then it is very difficult to because I tried also another exosomes, not plant but like human, and it was very painful for the patient. But now this product absolutely comfortable. Yes, of course you need to apply some numbing cream. But it's absolutely okay. Да. Ну, в Ощерську. Ну, в апліка. А? Да. Yes, we can see now the questions, and I will also reply during my treatment. Yes, tell me, Yon, about the question.
It is helpful to rosacea?
Yes, these exosomes can be used also to treat rosacea because as you saw in the improvement scale, it helps with the blood vessels, so it prevents skin redness. So that's why for sure you can use them for rosacea.
Can be used under eyes?
Yes, you can use safely around the eyes. Now I am doing this. You work on the projection of the bone. Yes, with a very small papules. Okay.
If it is it good for post-inflammatory hyperpigmentation?
Yeah, so these exosomes can be used also for hyperpigmentation and post-inflammatory hyperpigmentation because because we have the effect of cell rejuvenation. So when we rejuvenate the cell, we really can prevent the formation of the pigmentation, and we can treat the existing pigmentation. Plus, it contains also citric acid, amino acids that work peptides that have the effect also preventing of melanin production, and also has glutathione, like antioxidant that we know that we actively used to treat pigmentation. So also we have this product Depigment from Presensa and brightness that we can use also in combination. So one treatment can be with Exosomes, after 2 weeks can be with the brightness or Depigment, and then another Exosomes.
How many sessions does we need for treatment as a giddiness?
Yeah. So how many treatments we need to have good results? So we recommend around around 4 treatments. They can be done once in 3-4 weeks, approximately 1 month. It can be 3-4 weeks, and if we do 4 treatments once in a month, between Exosomes, we can do another mesotherapy for example, from Presensa with the amino acid, Activize, any other, depending on what the patient needs, firmness for skin laxity, and then to repeat Exosomes. So approximately, once in a month, I would say it is perfect. Okay.
Is it good for melasma and chloasma?
Yes, so is it good also for melasma and chloasma? Yes, it can be used also for to treat hyperpigmentation, as we talked about post-inflammatory hyperpigmentation, the same for melasma, chloasma, because we rejuvenate the cells, and our cells have the potential to prevent and to treat existing pigmentation. But of course, if we want more quick result, we can combine with for example, Luminosa peel from Presensa that we'll have with trichloroacetic acid, mandelic and kojic, and with the Depigment mesotherapy.
What about maintenance session?
Yeah. If we talk about maintenance, we can do, for example, if we did around 4 treatments once in a month, then we can do 1 treatment in 3 months. Only 1 treatment in this case. Then we don't need more. So I have the last few products here. Product I will just inject. Yeah. You have another question there? Tell me till I finish and
We use 2 milliliter maximum. It's in 1 session.
So yes, the product contains 5 milliliter of hydroactivator. So if you see now, I used all the product, all 5 milliliters together with Exosomes, because I worked with the full face, neck and décolleté. Yes. So in this case, you use the full vials. In case if you work only for example, if you work only for the face, in this case, you can use, for example, 2 milliliters or 2.5 milliliters, and then another 2.5 milliliters. Yes. So Before the treatment, usually, because here the patient was prepared, we remove makeup, we can apply also exfoliate peel to hydrate the skin. Then after the treatment or after mesotherapy, usually I apply the a thin layer of absorbent mask with the vitamin C. And the patient or comfort sense, but a thin layer like a cream. So we don't rinse anything. And the patient already washes face or skin after 6 hours. In case, for example, if the patient also has a very deep wrinkles or for example, pigmentation or dilated pores, you can also recommend to apply luminosa peel, but very small amount. You apply only 0.3 milliliters on face and neck. Very thin layer, so it will not work like a peeling, but it will work like biorevitalization. And also after the treatment, what is important to have good hydration. So in this, because we need to hydrate the skin, and the patient after the treatment with exosomes has to use good moisturizer. So you can recommend so now I will apply small amount of vitamin C mask, but to have better moisturizer, I will combine with the Total Lift cream. Okay, so combine together and apply to the patient skin. And after, you can apply also sun protection, or in case if it's already evening, dark, then you can leave the patient without sun protection. So for at home, we recommend to the patient to apply good moisturizer. So I would recommend in the morning to apply vitamin C serum plus Total Lift cream, then sun protection. And in the evening, it can be retinol serum, and because this retinol serum is not aggressive, as you know, from Presensa, and after Supreme Effect cream. But serums, it's possible to start from day 3. So first 2-3 days only moisturizers, Total Lift and Supreme Effect. So you can see the patient has some, of course, little some redness, papules. This is absolutely normal after injectable mesotherapy, but usually these papules will, because concentration of hyaluronic acid is not very high, it's only 1%, so during maximum 8 hours, 6-8 hours, it will be they will be not visible like papules, and the redness will disappear maximum second day. So we finished our first treatment. Now we have another patient. I will work with microneedling. Cum vă simțiți? Bine. So the patient feels well, and yeah, so we will see after the result. I can tell you that yesterday I did for myself, for my neck, so you can see that the neck looks good. I don't have any reaction or something. So yeah, it's very nice. Thank you. Thank you so much.
Cu drag.
Da.
Ăsta ce preparat? Nou
Da,
ceva,
pe
da?
urmă, haideți pe
Pe
urmă.
urmă, da? Aha. Bine, bine.
Ну, осталось. She конец дойль, да. Да, смех. So we finished first treatment. Now I'm waiting for the second patient. I will also dissolve. Катюш, сейчас одну секундочку. Сейчас Катюша все сделает. Так, макияж сняли?
Да, сняли.
Сняли, макияж сняли. Okay, so now I'm ready to start next treatment. Yes, let me. Okay, yes. So I will start from the beginning because that patient she was prepared. Now I will show you like the full protocol when we start, from what we start. We start with cleansing milk from Presensa, deep pure milk. So it's perfect to remove makeup, to clean the skin. So absolutely, it's perfect for any types, any skin types. Even for very sensitive skin, it can be used to remove also makeup, even the makeup that is water resistant. Okay. So we clean the skin. Then we will use fresh Hydra toner to hydrate the skin. That also has glacier water, aloe vera, panthenol, oat extract. Okay. Okay, now we use fresh hydrotonic, so you can use with cotton pads, yes, or I also like to use it by the hands. So, but it depends how you like. I really love to use it in this way. So I put on my hands and just apply and massage for 1 minute. It also gives the effect of skin preparation. Then all the products that you apply penetrate much deeper into the skin. So of course also recommend this product at home. And when the patient use, after when they apply any products, they penetrate much better. So now I will apply exfoliate peeling. So this is a soft enzymatic peel that contain fruit acids, also small percent of glycolic acid, niacinamide, that also removes the dead cells, prepare the skin for microneedling treatment. Okay, so you can massage it for 2 minutes and then you clean it with water. This product is ideal in case if you want to do facial cleaning. In this case, you can apply the cling film and to leave it for 10 minutes and then to do extractions. So it's fantastic results. But home use exfoliate, you can recommend for the patients for those who have dilated pores, acne, to use every other day or even daily, like a serum, thin layer, and then the patients will have that great effect of skin shrinking of the pores, skin rejuvenation, texture, also redness. So it's very, very good. But for those who want pore shrinking, this is really the best treatment. In case if the patient have acne, you can combine. One day they apply exfoliate, another day they apply acnoless cream. Yeah. So now skin is prepared. I removed exfoliate. Now I also apply toner. So till I will prepare the exosomes. Okay. Okay, perfect. Good. Now let me prepare exosomes, and I will use them with microneedling. Okay, so a new box I open. I will just take this. Okay. I can use with the dermapen. I can work with dermapen with microneedling, but I have something new for you, something special. This is also like a new modality of using Hydra Gold micro needle. Why it's not? Second. I will explain you the difference between. It's the same micro needling, but it is some differences. I will explain you just before. So it looks like this. It's like a vial, and at the cup we have micro needles, but very, very thin micro needles. So first let's prepare our exosome peptide solution. I'll just take the syringe of 5 milliliter, because here we have 5 milliliter Hydra activator. So I take the product, and then I mix it. So what is the difference between this Hydra Gold needle and classic dermapen that we already know? And so here the needles also we can have depending, or we can have needles of 0.25, and now I introduce the Hydra activator inside the vial with the dry exosomes with peptides. This Hydra needle has very, very thin needles. So if we compare needles from dermapen and needles from this Hydra Gold needle, it's 10 times thinner. So it's 2-3 times thinner than the hair our hair. So it's very, very thin. So as the result, the trauma will be very very thin. So these micro channels will be very, very thin. So the healing will be very, very fast. For those patients who have very sensitive skin, it is very good to use it. So it's single use modality. Yes, we open this needle. I will show you. Second. But I will show you also with dermapen. So I show like upper part of the face. I will use this hydro needle. So here it's not visible because they are very short. It's 0.25 millimeters and they are very, very thin. Imagine 3 times thinner than our hair. And so we put here solution, and when we press, immediately the needle will penetrate inside the skin and the solution will enter immediately. So we will, now we have product dissolved. I take it back in the, so if we work with micro needling, usually 2.5 milliliters is enough. So I will take now, for example, I will take 1 milliliter for this hydro needle. I will use with hydro. So I open, I put here 1 milliliter of our exosomes, peptides, together with hyaluronic acid, amino acids. Yes, and now I can use, so when in order, so first you can do few, like to press on this circle in the middle, the product will come more fast. And then, so our skin is prepared, I will start to press. So patient feels, so the needles penetrate inside the skin and immediately the product is on the face. If you can show more, so to be visible, more close. But we can see immediate effect of erythema formation. Supportable? It's a little unpleasant. Yes, so we can see here the solution, and solution not too much. So we leave it, and then the skin, the exosomes penetrate through this micro trauma and also through the pores. Okay, yes. Sometimes it's like yeah, it's good also to work around the eyes. So you can work like this around the eyes. And we have very vertical penetration. So, and the rehabilitation is not that long as if we work with the dermapen. Okay. So I will work around the eyes and upper part with this hydro gold needle. And then for all other area of the face, I will work with the dermapen. So on around the eyes, you also can use just above the bone. So you go all over the bone. Okay, perfect. and the product comes out together with the passing. So practically I practically used for half of the face, and I used 1 milliliter. Okay, so this is the type how we work with the Hydra Gold needle. And the same you can work all over the face, neck, décolleté, hands, body, everywhere where you need. So you can easily work. Okay, so hope you liked this new method of using how we can use and how we can treat our patients. I really like this technology because the needles are very thin. So imagine comparing with Dermapen. So if now I will open, here I have 12 micro needles. If we compare the needles of Dermapen, you can see them, and you compare here the needles, you cannot see them. So they are very, very thin. So yes, classic microneedling is also good, and we know that it works well, but in case if the patient has very sensitive skin, you can use better this modality, Hydra Gold needle. Okay, so now I will use Dermapen. So I took 12 millimeter tip, 12 microneedles tip. Now I will take another milliliter. So I will use another milliliter. Okay. So how I like to work with Dermapen. So for example, I took the product in the syringe, then I broke the needle like this, and then I like put like drops on the face, and then I use Dermapen. So here I will use 0.5 millimeter. 0.5 millimeter. Okay. So how I put few drops, and I work with microneedling. Classic technique. Yes. So I put also few drops, and I work with Dermapen. Yes, here also we can use different length of the needle. We can use 0.25 millimeters. If we need very, very superficially, we can use 0.5. We can use till 0.8 in case if we have post-acne scars, and post-acne scars and dilated pores, or very deep wrinkles. Questions? Ion, what we have there? For example, if you use with so the question is how many milliliters we need if we use microneedling for face and neck. So if we say face and neck, it's better to use 2.5 milliliters. It will be enough. If you do injectable, yeah, it's better to use all 5. But if you do with microneedling, 2.5 is enough. So if the question is also, it was if we already dissolve the product, if we can use it later, for example, or if we don't need for one patient. So we need to use, if we will have them in room temperature, we can store for maximum 72 hours. In case if you put in the fridge, you can use for during one week, maximum 10 days. It's a little sensitive here, yes? A little, sorry. But you can see that it is the product is enough. So if you if you do micro needling for face and neck is enough 2.5 milliliters. So you can use one box for 2 patients. But we need to use them during from 72 hours till 1 week.
Can we use it on hair?
Yes, the question if we can use exosomes for hair. Yes, absolutely. We can use, because we stimulate skin and we cell rejuvenation. So we can activate the hair follicles, and as a result we can have very good hair regrowth. It is also recommended to do around once in 3 weeks for hair, but between we can use also increase so for example, if the patient comes once in 2 weeks, once we do exosomes for hair, after 2 weeks we do increase treatment, microneedling or injectable, and then we do another exosomes. Okay, so now I finished the treatment. Now you can see after dermapen we have it's a little more traumatizing treatment, but at the same time, yes, we have this collagen stimulation from this micro trauma. But when we use this Hydra Gold needle, it's also good because we also have micro traumas, but they are invisible. Yes, but they are in the skin. So now we can see, Ion will show us that how red it was the skin on the forehead immediately during the treatment, but now it's practically calmed. And here around the eyes also, it's already practically calmed. Here, when I used dermapen, it's a little more red. And yes, here we will have more redness. So here possibly it will go after 24 hours. But after Hydra needle, it can go after 1 hour or maximum 2 hours. But it also depends if you use shorter, like 0.25, possibly it will go after even 1 hour. So it's like a fantastic treatment, and you can even make it practically non-invasive. After the treatment, what is important? So we wait till the product also is penetrated into the skin, and after also I will apply the mask now because here we have more skin, more red. I can also apply Comfort Sense skin for more sensitive skin with the algae extract, and also biomarine extract from algae that gives the effect of soothing and good hydration. It has very light texture and will calm down the redness very quickly. But we not apply it for 20 minutes like thick layer of the mask like usual, but we apply it thin layer like a cream, and the patient goes at home and can wash face only after 6 hours and need to apply moisturizer. But as I told you that it is very important to recommend to the patient to use good moisturizer, because after they can feel that the skin becomes more dry, because exosomes, they accumulate water in the deep layers of the skin, and superficial layer can feel more dry. So to prevent this, patients need to use very good moisturizer. So this is Total Lift cream, 24 hours, but you recommend the home use cream. So I will take a small amount of mask and also small amount, 1 milliliter and 1 milliliter of Total Lift. I mix them together, because if I will apply only mask, it will be not enough hydration. And I apply on the face. In case, for example, if you do the treatment for the patients with pigmentation, in this case you can apply white extreme cream that is recommended for the patients with hyperpigmentation. Now it can be a little sensitive. Нормально, не сильно. Patient can feel some little burning sensation, but it's okay. It will calm down during few minutes only. So you see that the cream together with the mask penetrate. If you apply a thin layer, it penetrates perfectly, and so you don't need something else. And just at home, a patient will use in the morning Total Lift cream. In the evening it will be Supreme Effect cream. Also, of course, you need to recommend under eye, circle eye cream. And starting from day 3, you can add serums. So in the morning you can add vitamin C. If the patient has mimic wrinkles, you can add with Botox-like peptides forehead serum. Or if you want better rejuvenation, you add retinol serum, and then cream Supreme Effect that we have night cream. So this is the treatment. I try to make it quickly, but in the same time full treatment. And now I think we can still answer some questions if we have time. And we will see also how skin will calm down after a few minutes. So let's see other questions. What?
I'm going to ask you some of the questions for participants. For example, Muhammad asked us if we can use exosome for the intimate area.
Yes, for sure we can use exosomes for intimate area, and in case if we have hyperpigmentation, in case if we have skin laxity in the intimate area, improve the skin firmness. Yes, for sure we can use it, and injectable and microneedling, and yes, we will also have fantastic results, because we can use anywhere on our body, because we rejuvenate the cells, and exosomes work through rejuvenating the cells, no matter it's skin in each area, or any skin problem, skin disease also can be used.
Thank you. Also, we have a question if it can be used with herpes or acne.
Yes, so if we can use, if the patient has active herpes with the vesicles, in this case we will not use injectable exosomes because injections can reactivate the virus. But topically, you can use them. You can, for example, the patient can, I don't know, you can give this already dissolved product and they can use at home topically in this case, because as we talked that the product can penetrate very easily through the pores, through the cells and through the appendices, so, and it will give more faster healing effect.
Okay, and also they ask us if we can use with psoriasis or sensitive skin.
Yes, for psoriasis, absolutely, it is possible to be used. We can also work with micro needles, with this Hydra Gold needle, because we don't need to traumatize too much. We know with the psoriasis, it can be a Koebner syndrome. So when we cannot traumatize skin too much, so maximum, or we do injectable if doctors do, or we can use Hydra needle very soft, or even topical application. And very sensitive skin, yes, in case if the patient has very sensitive skin, this seborrheic dermatitis, then for sure don't use micro needling, don't use dermapen, but use this Hydra needle with very, very thin needles.
Okay, also they ask when injected, how many ml per motion?
So if you inject, how many ml per session? Yes, this is the question.
Yes, per session, no, per injection.
One in each injection. So here you inject very small amount. You just need to see the papule. So you enter with the needle at the angle of around 35 degrees, and you enter 1-2 millimeters superficially, and you inject, like you see the papule like 2 millimeters papule. You cannot really, it's not, it's like 0.01 probably, not even 0.1, so very small amount.
Okay, also they ask us if we have a scar of surgery or burn, and we have for a long time, put exosomes in the area can increase the growth factors.
Yes, in case if we have scars, even the scars that have already not recent more or many years, for sure we can use. Of course, we will not have effect maybe immediately, we will need more treatments, but for sure we will have the results, because they rejuvenate the skin, they help especially the cells, and as we know, we have in our skin our own stem cells, so exosomes and these exosome peptides activate our own skin stem cells. So through these, it has this effect of regeneration and treating even old scars, just we need more treatments.
Okay, also they ask if we can combine with a chemical peeling, for example, luminosa PCA or TCA strong.
Yes. So as I told you, if we use, we can combine it with the peeling. If we did mesotherapy, we can apply the peeling even in the same treatment above, and it will be fantastic. It will be like peeling biorevitalization. But you can also apply, for example, if we work with microneedling, we will not apply peeling after microneedling, but we can apply also before. For example, we applied exfoliate, then we can apply, but small, only one layer of Luminosa Classic, for example, one layer, 0.5 milliliters on face and neck, and then after another 4 or 5 minutes, when it's already auto neutralized, because you know it auto neutralizes, you can start the treatment with but this you do only in case if the patient has scars or, but perfectly if the patient can come more, for example, if you do exosomes once in a month, between ideally to do like classic peeling Luminosa protocol, or strong or classic, depending on the patient's skin. So you do the peeling, 2, maybe 3 layers, then the patient has this exfoliation, skin is regenerated, and after 2 weeks you do exosomes. After another 2 weeks you do peeling. And you can do like totally 3 peelings and 3 exosomes, and the patient comes to you once in 2 weeks. So and it will be a very good result.
Thank you so much. Also, they ask when it's exosomes contraindicated.
Really contraindication, exosomes, plant exosomes, we don't have contraindication on the exosomes. We can have only in case if the patient has allergy to one of the components of the hydroactivator, so hyaluronic acid, DMAE, this silicium organic. So only on if the patient has glutathione, so only in this case it can have they can have any reaction, but it's very rare because usually these ingredients do not provoke. But exosomes and peptides, they do not cause any side effects. Because we will not use them in case if the patient has like skin cancer. We will not work on skin cancer topically, but of course you will not do this. But other contraindications, we can really treat another skin diseases.
Okay, thank you so much. And another question, we will have exosomes course?
Sure, we will have on Dr. Lica Academy the Exosomes course. We will make this. Ion, you will, when we will do a filming, yes, because really Ion did all the videos. You never see him, but all the videos were done by Ion. So thank you so much. So we will see when. And we will we will record the Exosomes course, and then for sure it will be available on the Lica Doctor Academy.
Okay, thank you so much, doctor. I'm going to put my image now. So if anyone has another question, can send to us by email or by WhatsApp, and we will answer. So, do you want to tell something else?
Yeah, so now I just finish. I will just want you to observe the patient. So the skin a little calmed down, but still the redness after the dermapen persists. So on the forehead, absolutely no redness. So this is the difference of the method of application. But both are okay, both are good. This one more traumatization, more collagen stimulation, but you have the options for your patients depending on what what you want to do and if your patient's skin is sensitive or no. So thank you so much, dear doctors. I see that we are a lot here, and we will have all this video webinar registered in the good quality, so I will also send to Elia, and Elia you will be able to share. And thank you so much, and see you at the next webinars with Presensa, with the new product. As Mr. Walid told us that we will have soon another new interesting products. Like always, I work, as I told you, I work with Presensa more than 10 years, and I'm always waiting, really waiting for new products, because I know that everything that appears, it really works, and I'm always happy to work with such a good products. Thank you so much.
Thanks to you, thanks so much.
Thank you, Elia.
To work with you, and thanks to all the participants for being with us today. So we see you very soon in the next product launchment.
Thank you.